Hello, everyone, and welcome to Functional Fertility, the podcast designed to demystify your hormones, up-level your lifestyle, and supercharge your fertility potential. I'm your host, Dr. Kalea Wattles, and today we're going to cover a topic that is brand new to this show, that is yoga for fertility. Over the last 10 years, more and more research has highlighted the benefit of yoga for supporting optimal fertility in both men and women. And today I'm excited to chat with yoga for fertility expert, Lynn Jensen. Lynn founded her Seattle-based Yoga for Fertility program in 2002 and has since helped thousands of women and couples become parents through her classes, workshops, and retreats. She's a registered yoga teacher and yoga therapist, a registered prenatal yoga teacher, and a master teacher of energy medicine yoga. Lynn co-authored Yoga and Fertility, A Journey to Health and Healing, the first book devoted to using yoga to support fertility. In addition to Yoga for Fertility, she's taught Yoga for Women classes at Microsoft headquarters for over a decade, teaches energy medicine yoga, and has designed the yoga program for a National Institute of Health study on yoga and hot flashes. She also offers fertility coaching and leads Yoga for Fertility teacher training programs. Just a wealth of knowledge. I'm so happy to have you. Welcome, Lynn.
Thank you, Kalea. Thank you for having me. It's great to be here today. And I really, really appreciate your holistic approach to fertility and your interest in finding the underlying causes of the fertility issues and not just trying to address the symptoms.
That's all about what we're doing here. And I think part of that is this mental, emotional, spiritual component, which yoga really supports. And so the work you're doing is so important. And I'm so inspired by the way that you're leading women and couples through navigating their fertility challenges that come up by utilizing yoga. So this is super exciting to talk about this. And I'm hoping you'll give us an introduction by just giving an overview of some of the ways that yoga might support fertility.
Sure. Yeah. So you've just actually said one of the things that's important, which is that yoga really supports fertility at so many different levels. So it is the physical level that is being supported with things like, improving the blood flow and improving the hormonal balance, all of those things that yoga helps with. Reducing stress hormone levels in the bloodstream, getting us out of fight or flight mode, which many of us spend a lot of time in. So those are all the kind of physical ways that yoga helps. And mentally, yoga is also super helpful by helping to reduce anxiety and depression. And actually, there have been studies showing that yoga helps to boost the levels of GABA, which is a really important neurotransmitter in the brain for keeping us out of that depressive state of mind. So there are really important mental health actually benefits of yoga too. And then emotionally also, in my classes in particular, I try to bring in a lot of the support aspect as well, because I think that having that support around your fertility journey is super important. So we do, check-ins in my class so that everyone is talking to each other, even if it's an online class, we're doing that. I also have a yoga buddy program in my classes so that if people are interested, I will match them up with a yoga buddy, just to somebody else who can help check in with them and help them on their, any issues that come up during the week. So really on all those different levels, I think yoga can help support fertility. I will say that my classes are different. I always warn people when they join my classes that if you've been in a different kind of a yoga class, this is probably going to feel pretty different to you. And there's a reason for that. And it's because really our goals in yoga for fertility are different than when you go to a regular yoga class. Often, I think, a lot of the kinds of yoga out there now are more kind of get fit yoga. They're more what I call maybe yoga aerobics. And so the goals of those classes are pretty different from my classes. And goals in my classes obviously are to do everything that's fertility supporting. And that tends to be more gentle, a much more gentle practice than most of the yoga types that are out there right now.
Well, I believe it. I believe it that yoga is going to address so many factors that contribute to our fertility success. And I know that my own regularity in which I'm practicing yoga has ebbed and flowed over the years, as I'm sure it does for many people. But one benefit that I found, I would go to my yoga class and my teacher would ask us to set an intention at the beginning of the class. And I would say, just show up for yourself. Just keep showing up for yourself. And that reinforcement that no matter what happened during the class, that I was showing up and devoting that time to my wellness was so powerful and really rolled out into many other areas of my life.
Yeah, absolutely. And even just that idea of setting an intention is so important. Deepak Chopra, who I'm sure people know, he's written a million books, but kind of a modern day guru. And one of the things that he says that I really like is that, you need to set intentions, because what you focus on expands in your life, right? So depending on what you set your intention for, that's what's going to get bigger. Otherwise, maybe we're focusing on things that are pretty negative, and that's what's going to get bigger in our lives. So it's important to be intentional about that.
Right. And when you're working with couples, obviously there's some who are in the preconception phase, and then hopefully those couples get pregnant, and then they go through the pregnancy phase of life, and then ultimately there's a postpartum time frame. Is there a difference in the way that you recommend people are engaging with yoga during preconception and then pregnancy and then postpartum?
Absolutely. I mean, because, just the body is doing very different things depending on which of those stages someone is in. So we really need to pay attention to what's going on with them at that particular time. And, when in my classes, really my classes focus on that preconception stage. I am a prenatal yoga teacher, and I used to teach prenatal classes, but there are so many prenatal teachers out there now. It's pretty easy to find a prenatal yoga teacher, and it's not very easy to find a yoga for fertility teacher, because most of the teacher trainings, the prenatal teacher trainings don't teach that, and regular yoga teacher trainings also don't teach that. So someone would have to take a pretty specialized training to learn the yoga for fertility piece of it. Most prenatal teachers, I think they can also teach postnatal. That's usually included in a prenatal teacher training. So it really depends on what's going on, which phase they're in, what kind of yoga is going to be most helpful and supportive for them. Obviously, if somebody's in the second trimester of pregnancy, we want to be doing things that are supportive and appropriate for that time, that stage, and so on.
But the take-home message is that there are yoga practices that can support you through any of those stages of life.
Yeah, absolutely. And it's so important, really. I think, in all of those stages, the value is for the person going through it, but also for the baby or the future baby, because the baby's going to be in that environment, whatever environment's been created for that whole 9-month process. So it's important to have, you don't want the baby surrounded by stress hormones during that 9-month gestation period. So supports everyone. Yeah.
It just occurred to me to ask, do you have couples that are doing yoga for fertility together, or is it mostly an actually pregnant person or a woman who's trying to conceive?
So my classes are open to anyone who's currently trying to conceive, and also to people who might be like doing egg freezing, because that's kind of a new thing where people are not actually trying to conceive right now, but working on future conception. So my group classes are designed for women who are trying to conceive. I do private sessions for couples if they want to work on it together, and I really support that. It's so absolutely helpful, because one of the big things is for my students, I really want them to practice at home. I say it's like brushing your teeth. I mean, you could do an hour of it on Saturday morning and, that would be helpful. But if you do a little teeth brushing all during the week, that's even better. So same with yoga. So if you have, if your partner's also bought into this and also able to do the practice with you, or at least support you in the practice, that makes it so much easier. And of course, the benefits are the same for the men also. Yeah.
I imagine the bonding that can happen, the time that you kind of carve out to spend together, and like you said, the stress reduction, which can affect both partners. So I think that's beautiful, everyone who's out there doing their yoga together.
Yeah, and actually you bring up a really good point about that, because a lot of times, if it's been a long fertility journey, especially, the intimacy can be really strained. And yoga offers a way, and I often give people partner poses to do too together. And it offers a way to be physically intimate without having that whole we're trying to conceive hanging over their heads.
Pressure of it.
Yeah. Mm-hmm.
Right. As we think through all of these stages of life, you mentioned that maybe someone is doing egg freezing, or maybe they're doing IVF. And I wanted to highlight this article that was recently published in Yoga Journal called "My Doctor Told Me Not to Practice Yoga During IVF." And you were actually interviewed for this article and offered a great perspective. And I read through the article and I totally understand why someone might be maybe cautious because of the way that the ovaries are so stimulated and because of the way that they can essentially become swollen during an IVF process. But I'm hoping that you will share, kind of recap your perspective on the practice of yoga during IVF specifically.
So, right. It was an interesting article because the woman who wrote it had been through IVF and had been told by her doctors not to practice yoga. And that was like her lifeline. So she was like, oh, and obviously it's a pretty stressful time. So we don't want to lose our lifelines during that process. So, yeah, we do have to be careful. We do have to pay attention, and we do have to modify poses during IVF. But I would say that at any one time, in my weekly classes, might be up to 50% of the people are going through IVF cycles. So we can work with those and modify as needed. So my classes actually are pretty small. They're limited to 15 people because that's as many as I can keep track of who might need to modify. And the first thing we do when we meet is do a check-in, and everyone says what's going on with them that day so that we can modify if needed. So really the times that you have to pay attention during IVF is during the stim cycle. So if they're on stimulation drugs, definitely we have to be really careful and modify. And sometimes the practice looks a lot like sitting and breathing and very gentle movement, no twisting, no belly compression kind of thing. So just really being aware during that time. And then also post-retrieval, the ovaries take a while to shrink back down. It can be up to a week. So during that time, we really have to be just as careful. And then also immediately post-transfer. So if someone's doing a frozen embryo transfer or a fresh cycle transfer, for the first few days, I usually say 3 days post-transfer to really just do relaxation, maybe legs up the wall pose is always good. And breathing. And then after that, they can go back to the gentle practice that I suggest for the second half of the cycle, the luteal phase, where we're kind of doing things extra gently anyway.
Mm-hmm. What's coming up for me as I'm listening to this is it's an opportunity for us to shift our mindset away from like the only productive work is the what you called yoga aerobics, like the high intensity dripping sweat type of yoga, which many of us enjoy at times, but this is a real opportunity to look inward, slow down, and focus on the restorative practices while we're in the midst of a potentially huge life change.
Yeah, absolutely. You've really hit the nail on the head with one of the issues that I see with people coming into my class, because I would say, a large percentage of my students are pretty type A, and they've been, very successful in their lives with that personality type. But fertility journey doesn't really lend itself to that type A energy. Working harder at it is not going to help. Pushing more is not going to help. The things that are going to help are what you just said, which is learning to slow down, learning to take things easier and not push ourselves maybe so hard, right? These are not things that are helpful from a fertility standpoint. And what's more helpful is being in that good self-care mode, like you were talking about earlier.
Right. And I've seen you write and post about oftentimes, no matter where we are in our fertility journey, we feel this sense of urgency. It's like once we decide we want to be pregnant, we wanted to be pregnant last week, and every single day feels agonizing. So how do you help your clients kind of navigate that sense of urgency and maybe use yoga to be more in the present? How do you do that?
Yeah, absolutely. So one of my classes this past week, we've actually just been working with that idea of being present and really paying attention to, on the yoga mat, is your body here and your mind here, trying to do the same thing at the same time. So that's one way to work with it, is not to allow your mind, we call it the monkey mind in yoga, not allow your mind to spin out here into the future, like, oh my gosh, what's going to happen? Is this going to work? Or into the past, like, why did that happen? Why didn't it work? So try to keep the mind really present. And that's a really key thing for stress reduction, in fact, just learning to do that being present practice. Was there a second part to your question?
Nope, I think that makes great sense. And I'm just thinking about my own practice of yoga and how when there's been times my mind is going and it's so hard, it's like you can leave it on the mat and just be present. And that has been so helpful for me. And anytime we're faced with extra challenges, which I feel like even when you're not facing any fertility struggles, just the knowledge that you are trying to conceive and that life is going to be different and that there's unknowns, I mean, no matter what, can, really stir up some feelings. And so having a tool like yoga that can help you to anchor into your own body in the present moment is just so powerful.
Yeah, really powerful, because we don't do that. I mean, really, we don't. Most of the time, if you think about it, your body's doing one thing and your mind is off doing something else, right? You're driving down the road and you're not really thinking about your driving. You're thinking about, okay, I'm going to stop at the grocery store and this is what I'm going to buy. So it's really not a practice that we're used to doing, but it's super valuable.
Very, very valuable. And I wanted to touch on some you recently shared a piece of research that was led by Dr. Alice Domar, and she's a brilliant mind body medicine researcher that so many of us have been following her work for a long time. And she showed some research that yoga and meditation increase the chance of pregnancy more than threefold when compared to a control group, which is just incredible and fascinating. And so I wanted to get your take on that. I mean, we've talked a little bit about the stress reduction. Do you think that that's really at the root of why we saw such an improvement in the patients who are utilizing these tools?
I think stress reduction is a big piece of it. Yeah, absolutely. Again, it's going back to what we talked about at the very beginning about the physical, the emotional, the mental, all those different levels. One of the things that Dr. Domar's research showed is that women who had a high level of depression or anxiety had much worse outcomes in the IVF process or just trying to conceive. So there's definitely a mind-body connection here, right? If the mind is not in a good space, the body's not going to be in a good space either. There's another woman, Dr. Sarah Burga, who she's now at the New York University in Buffalo. And she's done a lot of research also on yoga, on fertility and stress, I should say. And one of the things she talks about is that cortisol, which is that stress hormone, blocks the signal from the pituitary gland to the ovaries, telling the ovaries to, okay, it's time to release an egg, right? So just those kinds of, I mean, they're physiological changes that happen due to what's going on up here. That mind-body connection is super clear. So I think there are so many ways that yoga and mind body practices can help the process. I even had an example of a student one time who had gone to have her, just kind of initial test done, and the clinic told her that her fallopian tubes were completely blocked and that her only option to get pregnant was IVF because of that. And she had extreme, doctor's office anxiety, which many people have. So she joined my class. She was in my class for about 6 months, and she ended up changing clinics and had to have all those tests redone again. She said when she went in for the hysterosalpingogram to check the fallopian tubes, that she did deep breathing when she was sitting in the waiting room. She did deep breathing during the process, and they came out with the results that her fallopian tubes were fine. There was not a blockage. She'd been so stressed that her muscles had just completely contracted around the fallopian tubes. So even from a very physical standpoint, learning to do those relaxation procedures and techniques can be helpful, in a really physiological way.
I'm remembering moments ago how you said you like patients to do their homework and to do some of the exercises at home. And I'm just realizing how you could actually apply some of these techniques, like the breathing that you use in yoga. She just applied that in the doctor's office.
Absolutely.
There are so many scenarios in which you can utilize those tools to help you get through when life gets hard.
Yeah, absolutely. I've even had students tell me after their IUI procedure, they told the nurse they were going to do legs up the wall in the exam room. So yeah, you can bring them in for sure.
Those skills will never leave you. Well, this is the perfect time for me to ask about some of your yoga for fertility classes, because I know that you have had classes that are designed to help with parents-to-be who faced some challenges, things like miscarriage or their IVF cycle didn't work out. How can the practice of yoga help us through some of those times where there's grief and maybe some trauma and sadness?
Yeah, absolutely. So I think that, as anyone knows probably who's been on this TTC journey for a while, grief and loss is a part of the journey. It just is. I mean, every month, when we get our period again, and we're hoping that we're not going to, it's a loss. And we do need to grieve those things. And many students that in my classes have been through one or more miscarriages. So there's just a lot of loss wrapped up in the whole fertility journey. Yoga helps with those kinds of issues by helping to move the energy and move the emotions. We don't want to hold on to that. Of course, we're going to feel the grief, but we really need to allow it to move through and be able to process that. And the yoga mat is a great place to be able to do that.
Yeah, I've been in yoga classes where there were certain poses, and I don't have enough expertise to explain this, but doing certain poses where emotions just come up.
Yes.
And especially when it's a safe place, like if you know your classmates and you feel comfortable with your teacher, do you find that your students are processing emotions sometimes in your class?
Yes, I definitely find that. People cry in my class. We have Kleenex boxes sitting around, but it's important. It's important to be able to move those emotions out. And the other thing is that my classes, because they're small and they're super supportive, everybody in the class has been through this. So if you're crying this week, somebody else is going to be crying next week. So people feel really safe and comfortable sharing in my classes. And that's why my classes they're not drop-in classes. They're series classes, usually 7 or 8 weeks. So people know who's going to be there every week. And it really becomes like a support group for people.
That was one of my favorite parts about when I was going to yoga class regularly is you have your friends and there's this sense of community. And even when you show up on the hard days, I know there were some times I would go to class and I would just end up laying on my mat. Like that's what I had to offer on that day, but it was fine. And it was such a supportive environment.
Yeah, really important to be able to do that and do what your body feels that day. And especially going through fertility procedures, there are just some days where I have people in my classes who have started their, just started their stimulation shots, and they just started their period the same day. And it's like, that's a lot. That's a lot of hormones. And people, it's fine to just come and take it easy. Sometimes people just show up for check-in if that's all they can manage that day. Sometimes they just come and share, and then they're like, okay, I'll do the practice later. It's all totally fine.
Yoga is there to meet you wherever you are, and I sure appreciate that.
Absolutely.
Lynn, I wanted to talk to you about the Chinese 5-element energy system, because I know this is something you teach, and this is fairly new to me, but am I understanding through my research that in the fall, we are now in the metal element?
That's right. Yes. So
Okay.
yeah, great. I'm so happy that you asked about this, because I love to talk about the energy medicine piece of what I do. I actually teach classes I call energy yoga, which they're not just fertility oriented. They're open to anyone, but they're also very fertility supporting. And then I bring the energy medicine techniques also into my yoga for fertility classes. Sometimes I just sneak them in, and sometimes I tell people what we're doing and why we're doing whatever it is. So the metal element is associated with fall season, yes, as you've said. And interestingly, when metal element is out of balance, it looks like, well, it can manifest as grief, and also as an inability to let go of things, and a tendency to hold on to things, even if we need to really release those things. So when metal's out of balance, that's what it looks like. Metal in general is pretty analytical. It's pretty linear, and perfectionism is a big part of metal. So I think, I do tend to have people, I'm going to say a fair percentage of people in my classes that have a lot of metal in their personalities. So working with some techniques to just help balance that is really super helpful, and especially helpful during fall, because this is the time when metal element is at its peak.
Wow, this is so fascinating. So as you're working with this energetic system, I'm imagining there's a yoga, obviously, is something that you can do, but there's lifestyle practices or herbs? I mean, do people use a kind of a multifaceted approach to address all of their energetic systems?
You certainly can, yes. My focus tends to be on the more physical techniques of energy medicine. So we might be, say, holding points on some of the meridians that are associated with metal element, which happen to be lung and large intestine, big detoxing systems that are associated with metal. So there are ways to work with the meridians for that element. And there are even sounds that are associated with helping to process each of the 5 elements.
Wow. Okay. And I can see how, you mentioned like guilt and grief and anger and all of these different feelings that I'm sure you're addressing through these systems. These are all going to come up during your fertility journey. It's so easy to feel anger towards ourselves, towards our partners, to the world, and having these tools to help move those emotions through so we can process them is just really invaluable.
Absolutely. Yeah. And, like anger, you mentioned, I know that's often a big one in the fertility process, as you said. And that is associated with wood element, which is kind of at its peak in the spring. So, but working with all of the elements, and also other energy systems. So in energy medicine, I work with not only the Chinese 5-element system, but the meridian system in general, and the chakra system. So, for instance, we might be working with the chakras as a way to help balance hormones, and to clear energy in a specific chakra area. So I bring in a lot of different energy systems. The system that I have studied with Donna Eden, who is an energy medicine. I mean, she's now in her 80s. She's a really amazing energy intuitive. And also Lauren Walker, who has written a number of books on energy medicine yoga. And they work with actually 9 different energy systems, and the Chinese 5-element system is one of those.
Wow. It's so, I think, nice when we can go through a fertility journey and we kind of end up pathologizing our lives and kind of overanalyzing our physical wellness. And so having these tools that we can tap into that shift the emphasis to more how we are experiencing our lived experience of the world,
Yeah.
I think is just incredible. Lynn, I wanted to thank you so much for your time. Will you let our listeners know, because you're practically my neighbor here in Seattle, will you let our listeners know where they can find you?
Yeah, sure. So on my website, it's yogaforfertility.net. And I'm teaching weekly classes online. And also, if you happen to be in the Seattle area, I'm teaching an in-studio class on Tuesday evenings. I also offer sometimes online workshops. I offer private sessions and fertility coaching, and also yoga for fertility teacher trainings. So trying to get more yoga for fertility trained yoga teachers out there into the world.
Wonderful. Well, everyone knows where to find you. Thank you so much for sharing your insights and your passion. And I just admire all the work you're doing to support our fertility community.
It is great to meet you, my neighbor to the south.
Yes.
And thank you so much for hosting me today.
Thank you to all our listeners for being with us. And big thanks to our show's producer, Paola Martini. We'll see you all next time. Did you love this episode and want to hear more? Head over to drkaleawattles.com/podcast, where you can find more episodes on all things fertility.